We're finally finished with PowerPoint-driven death by sharp training. I'm Lawrence. I'm a sexual assault response coordinator. My disclaimer is in the video description below. The new standard is a leader-facilitated discussion with your teammates using a graphic training aid. GTA 19-11-001 is the new standard for content. It's broken into 5 modules: prevention, bystander intervention, sexual harassment, sexual assault, and retaliation. They can be conducted together or they can be broken out separately over time. Module 1, prevention. The first panel for prevention is found on the back. This panel is basically the public health socio-ecological model applied to our formation. The first level is the individual, then your peers, family, and friends, your unit and organization, and your post and community. These highlight a couple of things. One, prevention happens at all domains or all levels. And the second, this is the way that moving forward, the Army is going to highlight risks at each level and mitigating factors at each level and target interventions to have more protective factors at each level and mitigate the risk at each level. The second panel focuses on healthy relationships. Relationships are obviously built on trust and healthy communication. It's important to be open about your boundaries, have the ability to say no. If you drink responsibly and have a plan. When possible, travel with friends or in a group. If you see something inappropriate, step up and say something. Always achieve consent and look out for each other. Okay, we're going to talk about healthy relationships. It can be an existing relationship or a new relationship that is forming. It needs to come at a healthy pace, be based on trust, based on honesty. You should be able to maintain who you are as a person. You should be respected. You should respect the other person, obviously. You should understand that you're equals. You should take responsibility for your actions and your comments in this relationship. You should be kind and empathetic, but you should also have fun in a relationship. It should be marked by a healthy back and forth. And when there are conflicts, they're resolved in a healthy manner. An unhealthy relationship, on the other hand, it might be marked with an intensity that's not characteristic of where you are in knowing that person. This can lead to possessiveness, trying to keep that person or be kept to yourself, manipulation, where you try to manipulate or control the other person, isolation, which is a tough one. It can be a challenge sometimes when you or a friend are in a new relationship and there's that new relationship smell where you want to spend time with the other party versus isolation where that party is intentionally keeping someone from their support group and their friends. A step further would be sabotaging the person's career or interest to, again, facilitate isolation, or belittling them and attacking their self-esteem and their sense that they are an equal in this relationship. Guilting, where one party makes the other party feel like they're responsible for everything wrong in that relationship or that person's life. Being uncharacteristically volatile, flying off the handle. Deflecting responsibility, where anything wrong, again, goes to one party versus what's fair in a healthy relationship. Or acts of betrayal, where that trust is violated. The third panel in prevention is what we often call the Continuum of Harm. You've likely seen this chart before. It's been in sharp training for many years. What this chart demonstrates is at those 4 levels, individual, relationship, unit, and post and community, the protective factors for your full range of misconduct or interpersonal violence, be it domestic violence, child abuse, harassment, sexual assault, or suicide, tend to line up. The risk factors also tend to line up. As things progress from where you want them to be in the green, you see an increase in risk factors, you see a decrease in protective factors, and the further towards violence you get, the greater the amount of risk and the least amount of protective factors that we can throw in to mitigate that situation. Put simply, we need to keep each other above board. The further we stray from the green, the higher the risk and the less we have in our toolkits to bring it from red to green. The best thing you can do in terms of prevention is keep yourself and your units on the healthy green side of this chart. If you know anyone who would benefit from this content, consider hitting the share button below and sending it to them through text message or email.